When we talk about the disease, influenza, commonly called the flu, could be the very first one pops up in our mind. Why? Because almost everyone on the earth has had this kind of disease, and it has a long history of making human beings sick. Nowadays, there are still over 3 million people catching the flu, and more than 650,000 people die due to seasonal flu each year worldwide. In Canada, an average of 12,200 hospitalizations and 3,500 deaths related to the flu occur each year. In 2009, an H1N1 flu pandemic widely spread all over the world and killed 16,000 people within a short period. You might think that the 2009 pandemic had already been fatal enough. However, 100 years ago, a similar subtype of H1N1 influenza virus, named Spanish flu, swept the globe. At least 500 million people caught it. 50 to 100 million people died of it. Why was it so lethal? What was different? What stories could be buried back in the day? Today, we will find the answer. This is Sky Ning, and welcome to this episode of Revealing. This is the Macwitt family. Stan and Addison were the close sons in the family. During the World War I, both of them got enlisted and fought in the front line. After the war, Stan caught the Spanish flu, but did not know anything about it, as well as his wife Margaret. They both passed away shortly after because of the pandemic. It was such a pity for the family, but they were just one of those thousands of families in Canada. The flu not only had massive impact on individual families, but also on the country. In fact, the Spanish flu was very different from the other common flu viruses. The pandemic killed approximately 55,000 people in Canada. Most of the victims were young adults between the ages of 20 and 40. That was the opposite of what we are experiencing today. The reason why it killed more young people was that this virus would cause a cytokine storm in the human body, which means the immune system would overreact and result in the damage of the organs. The young generations had better immunity, but when it came to overreacting, it was the worst situation for them. The fact that the 1918 pandemic had more impact on younger adults meant a lot. On the one hand, there were no worse things such as losing the young adults in the family, and it was no different from losing the backbone of the body. Nobody would be able to support the family that strongly within a short time. No doubt that those families would have to experience some time of hardship. They had to face the hunger, horror, and the pain of losing their loved ones. On the other hand, over 60% of the Canadian population was between 15 and 64 years old. That means Canada would have lost many young men and women, and for a country just suffered from the World War, it was a catastrophe for the country's productivity and economy. Thousands of factories were shut down. The society was in such a panic. Now we understand the impact back in the time. But you might have got another question. How it spread so fast in Canada? There are some reasons. First, there was not a federal Department of Health, which means little health care and prevention on disease. That also led to the lack of public awareness of the flu and other disease. Second, the censorship on media still existed in most countries due to it was just after the end of the war. The public had no way of knowing the symptoms of the Spanish flu and how to avoid catching it. That made the exponential growth in the number of patients possible. Third, because it happened just after war, the soldiers were sent back to their country of origin, and some of them carried the virus back as well. Fourth, the medical technique was still not advanced. Patients were not isolated well, and there was no specific medicine for virus. The only thing they could do was letting the fate decide their destination. Now, you should have known many about the Spanish flu. Why do we need to learn about it after 100 years? That is because it still affects our life in many aspects. The Spanish flu directly led to the foundation of the Federal Department of Health in Canada, the predecessor of Health Canada. The disease promoted the research and development in the medical field. Many effective vaccines and antivirus medicines came out later, which could save the millions of lives. Until today, scientists are still researching the virus of the Spanish flu, trying to find the relation between it and other H1N1 viruses, so that we could wipe out all the subtypes one day. It is great that today we do not have to live with the horror of disease at most of the time, and we could always find a way to treat the illness. The pain of the sickness can be lessened, but the history and those precious stories cannot be forgotten. The lesson that the Spanish flu brought to Canada and the world was crucial, not only for yesterday, but for today and tomorrow. And it gave people more aware of the disease, gave scientists more power to make a study, and gave the government the strength to create a more livable society. We have to be grateful to all the people who experienced the horror, and when we are old, we will still be able to tell our children about what happened back in 1918, because only in that way can we avoid the repeating of the tragedy and make the stories live forever.